Welcome, friends, to Bride of Messiah. If this is Hebrew Nation Radio or on the YouTube, it's just welcome to a focus on health this time. Health is really wealth. It's one of the most essential things we could have in order to serve God well. And Christ's name, Hebrew name, Yeshua, means health or safety as well as it does salvation. If you don't have health, you really don't have life very long. It's a function of how good your health is. If you've got great health, you don't see anything coming for you. I will be 80 next my birthday, and I'm happy to say that I don't see anything coming for me. I believe I'm going to live to see the Lord come. And I want to talk today about this area because I was trained in health. I was trained in medicine as well, which is really not about health. And so I'd like to make some interesting points or differentiation. I took my training at Loma Linda University, which was founded by Ellen White, a Seventh-day Adventist woman who had enough foresight. I'll just say that at one point, somebody overheard a conversation of a Seventh-day Baptist with someone else asking about their church and comparing it with the Seventh-day Adventist church. And why the difference? Because the Seventh-day Baptists have been in existence for over 300 years, well over that, and only have about 55,000 members worldwide, whereas the Seventh-day Adventists have 22 million in less than half the time. And so we have the Adventists have publishing houses and hospitals and schools, colleges, etc. around the world. And what's the difference? This Seventh-day Baptist was answered. He said it was Ellen White. And yes, her counsels enabled wise planning and doing and growth for the church. To the point that I believe she was inspired by God while the church leaders really were repeating Israel's history of bad mistakes and doing it the human perspective way. Ellen White saw from God many issues of health. The best clear, obvious example I can give you is that tobacco back in the mid 1800s was being recommended for people to smoke because it might help them against tuberculosis. Well, we now know that is a stupid mistake that doctors made then, but we're still making stupid mistakes, okay? And the obvious one more recently is she made this statement in her book, and by the way, I was listening to a woman pathologist, Dr. Agatha Thrash, who was married to an internist, internal medicine. They were graduates of Emory University, and they were atheists, didn't believe in God at all, but somehow a book, Ministry of Healing, came to their attention, and after reading it, they totally changed their lives, their philosophy. They bought a couple hundred acres in Alabama, Uchee Pines it's called. They formed an institution with home-like centers where people could come and be on a good diet for a month, and get well, and most of them did. So that food is your medicine, as Hippocrates said. And Ellen White was not stupid in this area. She was advanced. In fact, Clive McKay of Cornell University reviewed her writings. This was now about 60 years ago. I saw it was in a series of articles in the Adventist Review, but Dr. Clive McKay was himself an author, and he was amazed. He taught a course on the history of foods and nutrition, and he was amazed that Ellen White did not incorporate the fads and fallacies of her day. And he was amazed because the modern science had not been born that tested and did studies and compared and so on. He summarized about a 7 or 8 page review by saying that there's no better overall guide available today than the writings of Ellen White. And I have tried to follow that. I grew up frying my own eggs and hamburgers, But in college, I had exposure to Ellen White in a course that I took, and I decided to become a vegetarian. And I will say that at 80 years of age, I wouldn't. I'm so thankful I made that choice and decision because I'm, my cholesterol is low and I don't see anything coming for me. Basically, I have a hill behind my house and I jog up to the top and around the plateau and down once or twice a week, maybe. Maybe I should do it daily. I don't know, but at any rate, good health is wealth at this point, and I am sad to say that my kids haven't all followed it. And one was telling me last night of spending $1,000 a month on pain pills. 52 years of age. She was adopted, and etc. Her genetics she was blaming, maybe, I don't know, but how we live also affects how the genes manifest themselves, so that if you eat well, some of the cancer cells and things like that don't prevail. And I just say there's a marvel to the human body that we MDs do not understand fully when they give prescription drugs. Ellen White classically made the statement that drugs do not cure disease, but in most cases they change the form and location. And as a young medical student, I struggled to understand how that is so. I just couldn't see how it would be so, but after retirement, my wife got a bladder infection, and since I was retired, not writing any prescriptions, she went to her doctor, who prescribed a medication that wasn't my favorite, but it cured her infection in 2 or 3 days. She stopped the medicine, took it only as prescribed. But about 6 months later, she had spots under her skin, went to her doctor again, who did a blood test. He called urgently the next day, referring her to a hematologist, who did a bone marrow exam and found no platelets in her bone marrow. He thought maybe the spleen is overactive. He took her spleen out. And bottom line, bad situation, treated her with high steroids, gamma globulin, transfusions until she died of a stroke. So, that's medical care. I looked it up in the physician's desk reference and saw that the drug Cipro that she had taken could do that. That can affect the platelets. And but her doctor, her hematologist, signed her out idiopathic thrombocytopenic purpura. Fancy name. Sounds like, if you can give it a name, you really must know all about it. Well, that's nothing was more foolish and false, in my opinion, in medical care. And idiopathic, by the way, I was taught in my internal medicine residency, idiopathic means idiotic on the part of the physician and pathetic on the part of the patient. Idiopathic. Well, that's what happened to my wife, yeah, and I'm happily remarried, and he probably did the best he knew. It goes back to the drug that she was given, but adverse drug reactions are a leading cause of death, and you think, well, if they got alcohol off of TV, they would do the same with drugs if it was that bad. But the truth is, I went through U.S. Senate offices and talked to senators as much as I could. Sometimes you see their advisors who are maybe an MD or a lawyer or whatever. And one senator told me I was wasting my time saying they own us, speaking of donations to their re-election. The word is bastard, means illegitimate. That's illegitimate. It's not right for them to cave in to drug companies because they are getting a lot of money for their re-election. There should be a law against that. And they are sold out and not protecting America, but they're probably protecting their own investments in the drug companies. They probably have the stocks work fine for them, etc. Well, medical care is not health care. It's a leading cause, number one, of death. And I'll give you the medical references. JAMA, Journal of American Medical Association, in 1998, tax day, April 15. reported that adverse drug reactions in hospitalized patients killed 106,000 patients. And the definition of an adverse drug reaction was properly prescribed and administered. This is not an overdose. It's not a malpractice. Physician didn't know what he's doing. He did the right kind of drug for that kind of thing. It's available, it's prescribable, but the patient somehow reacts to it. Well, that killed 106,000 people. Can you really be sure that the drug isn't going to do it to the next patient you write that prescription for? I don't think so. And the next 2 years later, after the JAMA, Journal of American Medical Association, reported in hospitals, Western Journal of Medicine reported outpatients outside the hospitals, 199,000. And if you add them together, in the hospital and out of the hospital, it's 305,000. And now medical care is the number 3 cause of death. The first article in JAMA was 4th to 6th leading cause, but when you put them together, 305. And that's not all. In 2007, a report of a 7-year study from 1998 to 2005, 7 years, the death rate increased 2.7-fold. Okay, so multiply 305,000 times 2.7, and you get 824,000 deaths from drugs that are properly prescribed. And that is more than heart disease, more than cancer, and all strokes and the accidents and the rest of it. Okay, so medical care, leading cause of death, also of illness and disability, because many of these people go into nursing homes and are no good for anything the rest of their life, even if they didn't die. And by the way, when people go into a nursing home, about half those people die in the first year. Wonder why? Well, if there's any clue, it might be the fact that the average number of prescriptions in nursing homes is between 11 and 13. A dozen pills a day. Yeah, this is for your bowels if you need it. This is to help you sleep if you need it. This is for pain if you need it. Blah, 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 blah. Dozen pills. Not good. Not good at all. Nursing home is the last place I would want to go. We have a lady living with us now. A friend of my wife. They were both nurses. She was a supervisor at night. But she called from the nursing home. Alta Vista said, "They're killing me." Okay, what? Take me, please. And so we did. We got her home. I had to wheel her in a wheelchair. We got her off all of her pills. In the nursing home, her blood sugars ran over 300. Here in our home, after we tested it and got her off onto simple foods without the grease and oil and things like that, her blood sugar was half that, around 150. Not perfect, but you can live with 150 better than you can live with 300 plus, and all the drugs on top of it, you see. So that's just a clear statement of the fact that drugs are poisons, and Ellen White said it right. She referred to them as poisons and said that they changed the form and location. They did for my wife. When she had a bladder infection and it changed the form and location, she died of a stroke. Ellen White didn't use the modern term adverse drug reaction. That's what they call it in recent years. But in her time, it changed the form and location. She was exactly right, and she's ahead of medical science today, as was the Bible 2,000 years ago. And now what I'm going to give you is the biblical perspective on medical care generally, okay? And that is that if you just look at the word physicians with an S, you take a concordance, and by the way, I like the use of online concordance. It's so quick and easy. I can just click a little thing and type in either a text or a word I want to find in the Bible. Eliah.com is spelled ELIYAH.com, and click on concordance, and you got a little blank there. And what word do you want to look? Look up physicians with an S, okay? And you'll find 5 references in the King James. That's usually the alternate. I like King James. It's truer in the total picture. I could give you an example why. For example, when the first trumpet sounds in Revelation 8, verse 7, it says all the green grass was burned up. Uh, and I find that in James 1, 9 to 11, in the King James, it talks about grass. As the flower of the grass, so shall the rich man fade. If you have some other modern translation like the NIV, which, by the way, I heard someone say that's the non-inspired version. But anyway, some of these smooth, easy worded things, it's nice to hear them sometimes. I like the New English Bible on Ecclesiastes 3:5, which says, what is has been already, what is to come has been already. God summons each event back in its turn. That's easier to understand than King James. But overall, the King James is true when it says all the green grass is burned up, and as the flower of the grass, so shall the rich man fade. You have grass in both texts. NIV and all the other modern translations don't have grass in both texts. You wouldn't know that economic collapse is the first trumpet. It doesn't mean the rich men are dead. It just means they're not rich. Okay, and we are seeing it coming, I believe, in the near future. And I just say we're going to talk about these things on this channel, Hebrew Nation Radio. It's on Wednesdays at 4 p.m. Pacific time. If you want to Google or search HebrewNationOnline.com and click on the live button, you'll hear me at 4 o'clock on Wednesdays as a rule. So thank you for considering this. And just want to give a broader perspective from the Bible. The 5 references to physicians in the Bible are all negative. In Genesis 50, verse 2, Joseph asked the physicians to embalm his father. This suggests to me that they were losing so many patients they also did the embalming. And that's a commentary on unscientific medicine. But it's no better today with all the science that they've got, because pharmacology is a false science. They don't do long-range studies. They don't want to know what the results of long-term studies are. They just want to know what could happen and list it in the big fat book, Physician's Desk Reference, 3,600 pages of fine print of all the things that drug can do to you. Another example might be the purple pill advertised on TV years ago. Heal the damage. Well, heal the damage, that pill can give you 120 different side effects or adverse drug reactions. So not heal the damage. What a lie. And they ended up getting it off the pill. Just this past week, a medication, I got a thing on lawsuits, Zantac, okay, causing cancer, a link to cancer. Well, I prescribed that. It came out around 1983, and I've written prescriptions for years with Zantac before, should I have done that if I'd have known that it could cause cancer? I don't think so. It's better to learn how to live right, eat right. Let me give you an example. Zantac is to cut down on acid. Well, if people ate regular times instead of any old time, which confuses the stomach gets learned to cycle. And remember Pavlov's dog, how he rang the bell, fed his dog, rang the bell, fed his dog. The dog learned to salivate when he heard the bell ring because he knew food was coming. And we can do that with Ellen White's suggestion is drink some hot water before your meal. It gets the stomach ready. The water is quickly absorbed in 5 or 10 minutes. And so if you drank it 15 minutes before your meal, you would be better able to digest your meal, and you will feel also a sense of fullness, less hunger for people who have overweight problems. So it will help with weight, helps with the digestive fluids and digestion. Excellent statement from Ellen White on food. By the way, if you would be interested in her book, Health, Happiness, and Destiny, I can send you a copy. This little paperback copy says $7.95 on the cover, but I get them by the box, and it doesn't cost me $7.95 per book. And if you want to send me $5, you can do it. Send it to Ruhling, RUHLING 2 at PayPal.com. That will, or go to PayPal and send it. No, it's Ruhling2 at Juno.com. JUNO.com. My name is spelled RUHLING and the number 2 at Juno.com. And send $5. Go to PayPal and do that. I'll send you the book. Make sure you give them the address. Sometimes people forget. But anyway, excellent information on eating, the foods to eat. She didn't use the word cholesterol, but she treats that topic very well and says that those foods that can cause cancer, the ones that have high cholesterol, high fat, etc. In the Bible, they were to eat neither the fat nor the blood. That's Leviticus 3rd chapter, verse 17, I believe it is, last verse of that chapter. And God was, that was inspecting a sacrifice. You know, they had those feast days. They go down to Jerusalem, and it was a feast time, and they would kill a lamb and eat it and enjoy the feast, but they were to carefully inspect it, in contrast to what Omaha, Nebraska does, where a cow carcass can pass an inspector every 5 or 6 seconds as he stamps it approved, SDA, U.S. Agriculture Department inspected. Baloney, you know, as one inspector said, you just hope that the fog doesn't fog up the mirror, or you haven't missed something too big. But I took an hour as an executive examiner examining executives, and you don't know what's on the inside hardly. You know, this is you can't cut it up well enough to see it in 5 seconds as it passes by on the conveyor belt. A vegan, plant-based diet is safe today. All bets are off for other stuff, as far as I'm concerned. I was taught even years ago by one of my teachers that the virus count in eggs is high. Lots of viruses. So, you know, I grew up frying them and eating them daily. Loved them. But what they're doing to the little chickies in the cages and fattening up cows with their own manure, bad situation. So Ellen White shines. She's really still ahead of medical science and science practices today in pharmacology, which, by the way, in the book of Revelation is called sorcery, translated sorcery. Bad translation. They are obscuring the fact that pharmakia is the Greek word that deceives all nations. Pharmakia, pharmacy. We like the symptomatic relief, but look out, you can be sick from 2 things later soon if you take a drug for it. Try to figure out what is causing my problem. And just because a doctor can give it a name doesn't know he knows the cause. He doesn't, okay? In most cases, we were born, 97% are born normal, and what we get in our 30s, 50s, or 70s is due to what we've been putting in our mouth for most of our life, in the most part, okay? That's pretty sure. If you've had an accident, had an injury, yeah, you can have problems from that too. But what we put in our mouth is key. And in Bible times, the air was pure, the sunlight was good, exercise, they got plenty of it. We have so much labor-saving stuff, and the food was grown naturally. You know, it isn't commercially, and the soil's depleted. They're not doing the land like in Bible times. They let it rest every 7th year, and they weren't dumping in chemicals to it, etc. So lots of problems with regular medical care, and try to opt out. Avoid taking the drugs if you can, because you're better able to find the cause of your disease if you're not taking something to relieve the symptoms. I'm so thankful that I didn't yield to the headaches by taking drugs for my headaches, and I soon found that it was related to diet. I just didn't understand it at first, but I had an allergy to wheat, to oats, peanut butter. And a doctor who was an allergist discovered this from a special kind of testing called the cytotoxic test. Most allergists don't see food allergy as related to symptoms in the body. They just they prescribe for sneezing and other kinds of allergy, but anyway, they miss it. So let me just encourage you in closing to consider if you need help with a health issue, think of Health and Happiness by Ellen White. This is the soft cover, and for $5 you can get a hard copy like that. Go to Amazon.com and send $5 to ruling2@juno.com, and we'll send you the book. We got a box of them, and God bless you. Also, go to Hebrew Nation Radio online this coming Wednesday and hear an interview about my latest book that I think you'd like to understand and hear. The interview will be up for an hour on different topics, but the lead-off topic, I hope and believe, will be how a 9/11 event will trigger end times in 2023. That's huge, and that's my latest book, How a 9/11 event will trigger end times in 2023. See you later. Thank you very much. God bless you.